On this Wednesday night, more financial help from the feds for businesses drowning in the fifth wave.
We've been in a poverty situation.
Who's eligible for the new pandemic benefits with money and patience running out?
And we're probably going to dip into family savings.
Quebec cracks down while Saskatchewan stays the course. The patchwork of provincial responses as Omicron cases climb. The NHL benches players from the Beijing Olympics. What the game changer could mean for Team Canada. Plus, Santa's Village prepares for a COVID Christmas.
I know there has been lockdowns and everything.
A message from St. Nick on seeing the upside of a lockdown.
Global National with Donna Friesen. Reporting tonight, Jeff Semple.
Good evening and thank you for joining us. Just days away from Christmas, and for the second year in a row, the pandemic is putting a damper on the holiday cheer. The Prime Minister addressed the country today alongside Canada's top doctor and cabinet ministers, announcing new benefits and other measures to combat the climbing caseload. Across Canada, there are now more than 2,300 confirmed cases of Omicron. And take a look at just how fast this highly contagious variant is spreading. Late last week, Canada was reporting an average of 5,000 new COVID cases every day. Well, yesterday, there were more than 11,000. That daily case count doubling in just a few days. Quebec remains the provincial hotspot, reporting more than 6,000 new cases, and it expects to announce more than 9,000 tomorrow. That province announced measures on Monday, shutting down schools and some businesses, and Quebec went even further tonight, restricting indoor gatherings to 6 people or 2 family bubbles over Christmas.
I ask you to please cancel your Christmas parties if you can. If you choose to go ahead, please gather only on the 24th or on the 25th. And the most important thing is to be very, very careful with people over the age of 60.
For those businesses and workers caught in the crackdown, the federal government announced more financial help is on the way. But as Gaviola reports, it may be too little, too late.
I think it was a very hollow response. I think they could have done more and done more immediately.
3 of the 60 staff at Barbarian Steakhouse in Toronto recently tested positive for COVID, forcing it to shut down Tuesday for at least 10 days during what was gearing up to be a busy holiday season. Aaron Barbarian, who runs the restaurant that's been a fixture since 1959, says nearly 2 years into this pandemic, it's saddled with debt and obligations like rent and utilities. The extra federal support is a lifeline, but because it's structured as a rebate, the money won't flow until February.
We are adrift at sea right now, and we need them to come and help us right now. Once again, we're probably going to dip into family savings to keep everybody afloat. It's a very, very difficult time.
New federal dollars will be made available to employers dealing with capacity restrictions of 50% or more. They have to show revenue declines of at least 25%, and eligible employers can get wage and rent subsidies ranging from 25 to 75%. There's also expanded support for workers who previously weren't eligible because there are no official lockdowns in place. Though the service, entertainment, and hospitality industries are struggling with reduced customers and income because of new and ongoing restrictions. Think of this as the new CERB. Broader lockdown benefits will now apply to workers in areas with capacity restrictions of 50%. The benefit is $300 a week for those who've lost 50% or more of their income until May. The Canadian Chamber of Commerce is calling on Ottawa to let businesses know about repayment terms for federal loans, which remain a question mark after last week's fiscal update.
2 years in, businesses are cash strapped. They're, maxed out on their debt. They don't have those reserves anymore that they may have had earlier on in the pandemic.
For establishments like Barbarians, this wave is a brutal reminder that with the pandemic's impact on health comes a fresh toll on businesses too. Gaviola, Global News, Toronto.
Besides more funding, the federal government was also offering reassurance today that Ottawa is prepared for this fifth wave. But at the same time, the Prime Minister revealed that COVID-19 has infected his own inner circle. Couteur has the details.
But Omicron is here, and we're just going to have to hunker down and be careful.
Practicing what he's preaching, Prime Minister Justin Trudeau addressed Canadians from his home because 3 members of his staff and 3 security detail tested positive for COVID-19. Trudeau says he's tested negative, but has been told to limit his contacts.
We can't prevent every case. We can't actually detect every case necessarily because of the sheer numbers from the provinces and territories.
Dr. Theresa Tam says the key is to prevent any further impacts on long-term care facilities and hospitals, which have already been stretched to the limit.
We're having some concerns about manpower, that's related to the burnout and the relative exodus of many healthcare providers.
Each province is responding differently to the threat of Omicron. Manitoba reported its largest case count since May, a day after announcing new capacity limits. While Newfoundland and Labrador raised its alert level, imposing 50% capacity limits on funerals, weddings, and other gatherings.
Today we need to face things as they are, not as we want them to be. We will reassess where we are on January 10th to determine if we can change the alert level.
In BC, there's a run on booster shots and rapid antigen tests, with people lining up for hours hoping to get access.
It is going to be 2 to 3 hours, I think, to get tests.
So be prepared to wait.
Yeah, be prepared to wait.
Prime Minister Trudeau has said there will be enough boosters and rapid tests for everyone, even though the availability and administration has differed depending on where you live.
We're delivering more rapid tests now, 35 million throughout this month, with tens of millions more.
And they can't come soon enough for many who have endured nearly 2.5 years of lockdowns and limitations and are now facing the prospect of another winter holiday away from family. Jeff?
Michael Couture in Ottawa. Thanks, Mike. While many provinces are moving forward with new pandemic restrictions, Saskatchewan is not. Officials there are asking people to gather safely over the holidays, but there are no new measures. Both Saskatchewan and Alberta were hit hard by the Delta-fueled 4th wave, and as Heather Yourex-West reports, new modeling suggests the Prairies could be in for another rough winter.
As the Omicron Grinch steals Christmas across many parts of the country, there is one province heading into the holidays virtually restriction-free.
Our case numbers are, the lowest or second lowest in Canada, and we worked hard to reach that. And we don't have widespread Omicron transmission right now.
Saskatchewan residents can gather as they wish this Christmas, even as new modeling warns of an incoming Omicron surge. According to projections released by the Saskatchewan government Tuesday, without any new health measures, intensive care units will begin to fill again through the month of January. That's before the province has fully recovered from the previous wave.
I would have obviously liked to have seen some proactive measures taken in terms of cutting capacity at restaurants, bars, nightclubs, and so forth, as well as some indoor gathering limits so that we could try and slow this down a little bit.
These are largely focused at avoiding super spreader events.
On Tuesday, the Alberta government introduced new rules limiting capacity for large events. Venues that hold more than 1,000 people are limited to 50% capacity.
Consuming food and drinks is not permitted in seated audience situations in large venues or during intermission.
The province also encouraging Albertans to reduce their contacts and keep holiday gatherings small. Though hours after the measures were announced, the United Conservative Party held a holiday party in Edmonton. Organizers say it followed all current guidelines, but a second event planned for Calgary on Wednesday has now been cancelled. The Omicron Grinch strikes again. Heather Yourex-West, Global News, Calgary.
And it's the news hockey fans have been dreading. The NHL just confirmed that its pro players will not be competing in the Beijing Olympics in February. The league is blaming the pandemic for the decision, and the move is also prompting bigger questions about whether it's safe for the games to happen at all. Ross Lord reports.
COVID-19 infections have forced the National Hockey League to postpone more than 50 games and take an early holiday break. Now, hockey's best players are going to sit out even more marquee matchups at February's Beijing Olympics. In a statement, NHL Commissioner Gary Bettman said Olympic participation is no longer feasible and that current circumstances have made it impossible for us to proceed despite everyone's best efforts. Instead, the league will use the 2-week Olympic period for games it's been forced to reschedule. The Canadian Olympic Committee will need to find other players to wear the Team Canada jersey. The committee says it's excited to rally behind the men's team for its first game on February 10th. But as all NHL players know, there are persistent questions about whether Beijing should go ahead at all over human rights violations and because of Omicron and the potential health risks.
The Olympics as a whole, I'm sure there's a lot of conversations, being had about that. So, we'll have to just see kind of what happens. But it's a lot of moving parts right now.
Several countries, including Canada, have announced a diplomatic boycott, but there are calls for Canada to boycott the Games entirely.
The athletes have the power to do something, and they need to do the right thing here. Whether it doesn't happen for this Games, they need to use their athletes' commission. They need to go ahead and hold the IOC accountable for going to these places.
At this point, Canada's top women's hockey players are still going to Beijing. A statement from Hockey Canada says plans remain the same as we continue to prepare. Another best against best hockey tournament is still on, the annual World Junior Championship in Edmonton and Red Deer, Alberta over the Christmas holidays. Despite the widespread Omicron variant, spectators are permitted, although government rules have forced organizers to cut seating capacity to 50% for all games. The ebbs and flows of the pandemic making it tough to hit the target in Canada's national winter pastime. Ross Lord, Global News.
Still ahead, a stunning story of survival. The extraordinary lengths a Madagascar minister went to get to safety after a helicopter crash. At least one person is dead and dozens missing after a landslide in Myanmar. It happened at a jade mine in the country's north. Officials fear around 80 people may have been swept into the lake. Deadly landslides are common in the mining region. Just last weekend, at least 6 people were killed in another slide. In Madagascar, a government minister has lived to tell quite the tale after a helicopter crash. That is the country's Secretary of State for Police explaining how he swam 12 hours to safety after the crash on Monday. He was reportedly en route to inspect a shipwreck when the chopper went down. He said he and another man were able to eject themselves and both then made the marathon swim to shore. In Japan, for the time being, Big Macs will only be served with small fries. Starting Friday, McDonald's is taking medium and large-sized fries off the menu at its 2,900 locations in Japan, and that's because potatoes are in short supply. The food giant says the BC floods have slowed shipments from the Port of Vancouver, and as a result, the potato portions will be limited to small sizes only until December the 30th. Ahead, Omicron Q&A. From how much protection boosters provide to fears for the immunocompromised. Our experts tackle your questions next. Some good news from South Africa, where Omicron was first discovered. Case counts are down 20% in the last week, and hospitalization from Omicron appears to be lower than the Delta variant. That analysis is part of a study from South Africa's National Public Health Institute, and it found the risk of hospital admission was about 80% lower than Delta. The study has not been peer-reviewed, and the authors cautioned the findings don't account for the country's relatively young population and high levels of immunity. But if Omicron is indeed less deadly, what does that mean for the pandemic moving forward? To help answer that question and others that we've received from our viewers, we are joined now by 2 infectious diseases specialists, Dr. Lisa Barrett from Dalhousie University and Dr. Anna Banerjee from the University of Toronto. Doctors, thank you both so much for joining us. Very nice to see you. Dr. Barrett, let's start with you. This first question comes from Carla and sort of picks up on that point. She notes that Omicron appears to be milder than Delta, and if Omicron has taken over, why isn't that a good thing? Will Omicron eventually just burn itself out? What do you think?
Well, wouldn't we all love to know the answer to will it just burn itself out? I don't think we know the answer to that yet, but it does appear that while Omicron does transmit more easily among the population, there are early signs that it may be somewhat less likely to cause hospitalization than did its previous sibling, Delta. However, the data are early, and there's differing data from differing countries. South Africa different than Denmark, and even in Denmark, there was still about 0.5% of people who got infected that were still showing up in a hospital. And that sounds like a low percentage, but if you have 500,000 people infected, then 0.5% is a lot of people in hospital at the one time, which is why we still care, even if it's not as severe, about people getting a lot of infections in the population at the same time.
Yeah, excellent point. And speaking of a lot of infections, next question to you, Dr. Banerjee. If Omicron is indeed more contagious, are we at risk of becoming infected from limited exposure, like someone jogging past you on the street, for example?
So someone jogging past you, it's a very short period of time, and it's outdoors, and you're assuming you're masked, so the risks are really minimal. It's really when you're more indoors and you're sharing the same airspace as someone else, that's really when you're at higher risk, and if you're not using masks. So someone running by you, I'm not too concerned about that.
Okay, good to know. Dr. Barrett, back over to you now. This next question coming from Joanne. And of course, we've heard over and over again, our best weapon against Omicron is that booster shot. But how much less likely are we to become infected and to spread COVID-19 once we've had our booster?
Yeah, we're still working on that at the moment. I think the data are out there, and there are bits and pieces of information that are coming from the companies that make these vaccines, and they're looking in the lab at how likely it is for the virus to be shut down, if you will, by the antibodies that these vaccines produce. However, that's early data. The real world data, what happens in humans as we move through this, is still less clear to me. However, it does look like a booster will be helpful in adding extra protection to preventing against some of those serious outcomes. I want to make two things clear, though. Number one, infection is different than serious disease and death, and we do know that Omicron can still infect. So that's a little bit why we're still taking some of those public health precautions. And number two, even with 2 doses, if you haven't quite gotten your booster yet, it's still quite effective, even with Omicron, at preventing serious outcomes. So you can't use it as the only tool, vaccination that is, but you can use it as a good tool, and particularly after the booster dose. Exact numbers of protection yet to come, but never a bad idea if you have access to it.
Okay, we're almost out of time here, Dr. Banerjee, but this is one of the most common questions we've received from Elizabeth, who, like many others, of course, is immunocompromised and wondering whether she'll need a 4th dose of the vaccine, and if so, when?
So we don't really know yet. We don't know if it's going to be a booster dose, every year booster, or if the vaccine's going to change. It might be possible in the next little while they start taking, instead of the original alpha strain, they start making the newer versions of the vaccine, including like the alpha, the Omicron, etc. But depending on what strains are circulating. So we don't know if it's going to be a booster or a new set of vaccines that may come in the future. But I assume it will be. There will be some kind of vaccine in the future.
Yeah, and we've heard just this week from Israel, which is now moving forward with plans to start offering a 4th shot to people over the age of 60. So we shall see. Doctors Lisa Barrett, Dr. Heather Banerjee, thank you so much for joining us. Really appreciate it. And we'll be putting questions about Omicron to the experts all week. So please send us yours to yourquestions@globalnews.ca. Ho, ho, hoping for visitors. Next, the pandemic's effect on tourism at Santa's Village. COVID-19 is canceling a lot of holiday plans, but as any kid will tell you, Santa Claus is an essential worker. But even jolly old St. Nick is not immune from the effects of the pandemic. Tourism at Santa's Village in Finland is taking a huge hit. But as Redmond Shannon reports, even the pandemic can't dampen Santa's Christmas spirit.
Lots of nice and good children waiting for us.
He's checked it all twice. The sleigh is ready, the reindeer are fed, and the presents are piled up.
Christmas preparations are going quite well at the moment. It's only a few days till Christmas now. The elves have been working very hard, as always.
Trust Santa to see an upside to lockdowns.
I know there has been lockdowns and everything, and people have been together at the houses, but I wish that people should do things together more.
As the big man gets ready for takeoff, his very own holiday village in Lapland is welcoming visitors from around the world. A festive Finnish paradise in ice, sitting on the edge of the Arctic Circle.
I'm 48 and it's my first time here, and I wanted to visit Santa Claus, and I'm happy to come for the first time with my kids.
Very Christmassy, everyone is super nice, but it's really cold.
This second COVID Christmas had many visitors thinking twice before booking.
Actually, to the very last minute.
Till we boarded the plane.
Yeah.
Then once the plane took off, we said, okay, we're fine.
Honestly speaking, we thought about that, but everyone seems to be vaccinated, and you gotta hope you're lucky enough just to make it through, and well, so far so good.
Omicron has driven record new COVID case numbers in Finland. New travel and testing restrictions have punctured the rebound Lapland locals had hoped for.
I think the bigger question is from the feeder markets, do they let the people out and come back again?
You can't trust anything. You have to just wait and see what happens. So it's quite stressful.
An underlying anxiety and a place of wonder. But the busiest workers of all are taking hope from those who matter most.
Some kid wishes that the pandemic will end soon.
And so say all of us. Redmond Shannon, Global News, London.
And that is Global National for this Wednesday night. I'm Jeff Semple. We leave you tonight with this special sunrise at Stonehenge in the UK. Crowds of people gathered this morning to mark the winter solstice. Thanks for watching. Have a great night.